Your doctor told you that your vitamin D level is fine, that 20 nanograms per milliliter is sufficient, that 600 IUS per day is the recommended dose. In 2014, two researchers at the University of Alberta used the Institute of Medicine's own data to recalculate the real vitamin D RDA. Their published finding, the correct number is 8,895 IUS per day, not 600, 8,895. That is not a minor discrepancy. That is the official recommendation being off by a factor of 15, and 12 years later, it has not been corrected. Here is what I want you to understand before this video is over. What the number on your blood work actually means, and why 20 nanograms is not the same as sufficient. Why men over 50 are at specific hormonal risk from vitamin D deficiency that most doctors never address. What to take, how much, and the two cofactors without which vitamin D cannot do its job. And why carnivore and keto specifically affect your vitamin D status in a way most content in this space never addresses. Let me start with the study, because this is the most important piece of research most men over 50 have never heard of. In 2014, professors Paul Veugelers and Jean-Paul Ekwaru at the University of Alberta's School of Public Health published a paper in the journal Nutrients, titled A Statistical Error in the Estimation of the Recommended Dietary Allowance for Vitamin D. They used the exact same data set the Institute of Medicine had used to set the 600 IU recommendation. They simply ran the mathematics correctly. Their finding: the RDA for vitamin D to meet the requirements of 97.5% of healthy individuals is 8,895 IUS per day, not 600. This finding was independently confirmed by Dr. Robert Heaney and colleagues at Creighton University and the University of California, San Diego in a separate cohort. Both teams arrived at the same conclusion. The official recommendation is wrong by an order of magnitude. The Institute of Medicine has been aware of this reanalysis since 2014. It has not updated the recommendation. Now here is what makes this specific to men over 50, and this is the part most vitamin D content never addresses. Vitamin D is not just a vitamin. In your body, it functions as a steroid hormone. And as a steroid hormone, it interacts directly with the same pathways that regulate testosterone production. A 2023 systematic review published in the journal Cureus examined 8 studies involving adult men and looked at the association between vitamin D deficiency and testosterone levels. The finding: men with low vitamin D levels consistently showed lower testosterone levels. And research published in 2025 from the Medical University of Silesia confirmed that vitamin D status directly determines the cardiometabolic and hormonal outcomes in men with age-related testosterone decline. Here is what that means for you specifically. If you are over 50 and your testosterone has been declining, which it does in almost every man after that age, and your vitamin D level is in the range your doctor calls normal, those two things are not independent events. They are connected. The same deficiency that is contributing to bone density loss and immune suppression is also contributing to the hormonal decline your doctor is attributing entirely to age. The number your doctor calls normal, 20 nanograms per milliliter, was set as the threshold to prevent rickets, the childhood bone disease. That is the bar your doctor is using to evaluate your hormonal health, your immune function, your cognitive capacity, and your cardiovascular risk. The bar for preventing rickets in children. Research increasingly suggests that for men over 50, the optimal range for actual therapeutic benefit is between 50 and 80 nanograms per milliliter. Not 20, 50 to 80. Now I want to address the question most people never ask. If the mathematics was demonstrably wrong, why has the recommendation not been updated in 12 years? The organization that sets the RDA, the Institute of Medicine, now renamed the National Academy of Medicine, is a private organization, not a government agency. A private organization that accepts funding from the government, but also from private donors, including the food and pharmaceutical industries. This is documented and publicly available. When the organization writing the nutritional rules takes money from the industries that benefit from those rules, you are not getting independent science. You are getting compromised consensus. The error was found, the error was not corrected. The question is not whether they made a mistake. The question is whether they had an incentive to fix it. They did not. And men over 50 are paying for it every single day. In lower testosterone, weaker immune function, accelerated cognitive decline, and chronic inflammation. Doctors are treating as inevitable consequences of aging rather than the correctable deficiency the research shows it to be. Vitamin D deficiency is not a fringe concern. Research shows that 87.4% of elderly men have insufficient or deficient vitamin D levels, not a small percentage, 87.4%. Most men over 60 walking into their doctor's office with a blood work result that says normal are operating at a level the research increasingly identifies as functionally inadequate. But here is what makes the protocol actually work and what most men taking vitamin D3 are completely missing. There are two cofactors without which vitamin D3 cannot do its job, and I will show you exactly what they are. Now let me address the carnivore and keto specific angle because this is where most vitamin D content fails your audience specifically. When you significantly reduce carbohydrate intake and increase fat intake, which is the metabolic foundation of both carnivore and keto, your liver's handling of fat-soluble vitamins changes. Vitamin D is fat-soluble. It requires dietary fat for absorption from food sources. This is one of the reasons carnivore and keto actually support vitamin D absorption better than a low-fat diet. You have more of the fat matrix required to pull vitamin D into circulation. However, and this is the specific issue most carnivore content does not address, the primary natural source of vitamin D is sun exposure, not food. No food, including fatty animal foods, provides adequate vitamin D at the levels research suggests are optimal. Even eating salmon, egg yolks, and beef liver daily will not get you to 50 nanograms per milliliter without significant sun exposure or supplementation. This means that for men eating carnivore or keto who live above the 40th parallel, roughly the latitude of New York, Denver, or Madrid, for several months of the year the sun angle is too low to produce any meaningful vitamin D through skin exposure. For those months you are entirely dependent on what you stored during summer months plus whatever you supplement. The practical protocol based on the available research is this: get your vitamin D blood level tested. Not the active form, the storage form, which is 25-hydroxyvitamin D, ask for that specific test. If your level is below 50 nanograms per milliliter, you are below what the research increasingly suggests is the functional threshold for men over 50. On supplementation, the research supports supplementing with vitamin D3, not D2. D3 is the form your skin produces from sun exposure. D2 is a synthetic form derived from plant sterols that converts to D3 in the body, but at a lower rate. Take D3. The dose question is genuinely individual. Your body weight, your baseline level, your sun exposure, and your gut health all affect how you respond to a given dose. As a practical starting point, most researchers working in this area suggest that men with levels below 50 nanograms per milliliter begin with between 5,000 and 10,000 IUS of D3 daily and retest after 90 days. Now, the two cofactors that determine whether vitamin D3 actually works. These are non-negotiable and most supplementation protocols leave them out entirely. Cofactor 1 is magnesium. Vitamin D3 cannot be converted to its active hormonal form without magnesium. The enzyme that performs this conversion is magnesium dependent. If you are deficient in magnesium, which as we covered in the magnesium video, the majority of men over 50 are, your vitamin D3 supplement is not being converted efficiently regardless of the dose you are taking. Magnesium supplementation is not optional for men supplementing vitamin D3. It is the prerequisite. Cofactor 2 is vitamin K2. When vitamin D3 races calcium absorption, vitamin K2 is the traffic director that tells calcium to go to your bones rather than your arteries. Without K2, the calcium mobilized by vitamin D3 can accumulate in arterial walls and soft tissue rather than bone matrix. For men over 50 with any cardiovascular concerns, this is particularly important. Take MK7, the most bioavailable form of K2, alongside your D3. The complete protocol is therefore vitamin D3 at a dose calibrated to your blood level, magnesium glycinate to enable conversion. Test your level at baseline and retest 90 days after beginning supplementation. Comment vitamin D below and I will send you the complete protocol card, the specific forms, the dosing framework, the testing guide, and the sequence that gives D3 the best chance of actually working in your body. This connects directly to everything else we have covered on this channel. The magnesium video explained why the RDA is a survival threshold, not a therapeutic dose. The glycine video explained why your carnivore diet has a specific gap most content never addresses. Now, vitamin D completes the picture, another nutrient where the official number was set for disease prevention in a healthy population, and has been applied uncritically to men over 50 dealing with hormonal decline, metabolic dysfunction, and chronic inflammation. Real food does not have an ingredient list, but some of what your body needs at the levels your body actually requires comes from the sun and from intelligent supplementation of what a modern indoor life systematically eliminates. I am Josh. This is Created Carnivore. Real food does not have an ingredient list.